Dublin.
North side or south side?
Dublin. North side. Do you know what I mean? Like, oh, for fuck's sake.
For fuck's sake.
Jesus.
There's a technique.
Bota isso aqui na boca, ver se funciona igual.
Teoricamente funciona.
Are we good?
It's physics.
Hello, guys.
We're
start?
on? We're on?
Are we on? Are we on?
I was playing with my... Yeah.
Yeah, okay. Hello, guys. How are you? How are you? Thank you very much for coming. Today we have Igor. He is an amazing physiotherapist with a lot of experiences, with a lot of important things to tell us. And to be honest, things that I criticize a lot, he's explaining. And
like
I think it's worth everyone to hear.
What do you criticize?
You're gonna know.
Okay.
You're going too fast.
Time will come. That's what she said. So...
Thank you very much for coming today.
Thank you. Thank you guys to having me over.
No problem. It's a pleasure to talk about something very important because as you guys know, I'm a driver and that's really interesting for me. I'm full of questions,
All right. Yeah.
Oh, yeah.
Well, can I already start with a question?
Yeah.
You graduated in Brazil and you worked as a physiotherapist back in Brazil and only then you moved here.
Yeah.
And kind of give us an overview of your career because it's been a while.
It is, yeah. So I finished college in 2010. Then I went to work in the Brazilian health systems and I used to work in the ICU and also with neurological rehabilitation. Then I moved to here in 2016, started work as a care assistant, built up my career there until I became a healthcare assistant manager. And then I got my physiotherapy license to work in Ireland and start my career here.
Was it tough to get your license?
Was a very challenging. It's not that it's a difficult process. It's just a complicated and a lot of bureaucracy that delay the process. But I wouldn't see myself as something else.
Yeah, of course.
So I went through the whole process.
But the whole process, how long did it take you from start to finish?
It took me around 2 years to finish off everything. Yeah, since because back then everything was done by post.
Oh wow, that's nice.
Now the change, now the change is it's online process, and for example, they send back a paper that I need to review, and that would take 15 days.
Oh, okay.
To come back and just change two words and send back another 15 days.
And if it's still okay, if it's not okay, they'll send you back again. And then
so
that's insane.
It's just a complicated process, but it's not that hard. Regards the equity on Brazilian education and Irish education, we have kind of the same standards. And that's an easy thing. It's just how to explain what you did through college and your experience.
In terms of work, do you see much difference between how you used to work there and how you used to work, or how you work here? Or, I mean, even in terms of how you have to deal with people, because there is a difference, I think, when you deal with Brazilians, because we're all, and then when you deal with other, I am. And I know lots of people that are.
Well, I have to say that I love to work with Brazilians because I know what you guys are up to. So it's kind of easy for me to navigate on the rehabilitation process, which is a process, not only one-off treatment. Mm-hmm. So I know how to deal with that. With a non-Brazilian, I need to be a little bit more, how can I say? I need to explain myself a little bit more to them, because it is a type of approach that they're not used to.
Yeah, but do you think the language or the cultural barrier exists in this case?
Oh, definitely does.
Yeah.
We need to understand, as a healthcare practitioner, we need to understand that there is, everybody's different, and you need to approach them in a kind of standards of goodness, I have to say. Yeah. For example, let's an easy thing. In Brazil, I would say to, okay, now could you take your bra off? Straight, it would be a straight conversation with the Brazilians, which are non-Brazilian. I would say, would you mind if I ask, how do you feel about take your bra off?
Okay.
You gotta ask for the consentment all the time.
No, we're gonna ask for the consent for everybody, but it's the communication of this. I need to take a more careful in a different background, because we know there is a lot of religion background. We need to respect that, though.
I think there's a bit of a cultural differences as well. Like for us, we don't we don't give much of a shit, you know, like we will go to the beach just barely naked, and that's fine. That's our bodies.
Are we noticed back in Brazil?
You can find, but
we do ask. We take those measures, but I think for a Brazilian national in the health system, they know what to expect from the health system. It's different from the people, the European, that they don't have sometimes much information about that.
Yeah, that's
so very challenging. If the Brazilian came to me with the bra, she's gonna take the bra straight away because she's been to physio many times.
Yeah.
Do you know what I mean? It's different. I haven't seen a lot of patients that have been to the physio the first time in their life.
Yeah, it might be difficult because, I mean, you have to touch the person. You have to do your job.
Yeah.
And the way you touch it sometimes...
No, but you have to communicate well, though. You have to be clear. That's the thing. That's one thing that I had to learn here is to improve my communication skills and how to approach people.
Yeah, because back in Brazil, I used to do Pilates. My first class.
Did he set you in the wrong place?
Oh, yeah.
Did you like it?
He was like, between the anus and the balls.
Did you like it? Did you enjoy it?
Man, I'll tell you after.
Okay.
So,
okay.
That was suspense. But yeah, he asked me, can I touch here or there, or you touch there? You know, it's kind of tricky, man.
That's fine.
Yeah, but to deal with that,
we do deal in a more joke way.
Okay.
In Brazil than we do here. Here is very formal, and I think for most of the thing that how should be.
Okay, of course it is, because you're setting boundaries and everything. And as you said, it is probably likely that Brazilians have gone to physiotherapists many times.
So they're used to the situation and they're kind of a little bit more relaxed.
What is the average age that you would say that you see the most Europeans in general or Irishes come into your practice? You call practice, clinic, clinic, but still practice. What is the average age that you say, okay, that you get kind of shocked? Maybe those people, they have never gone to a physiotherapist before?
Well, the average age of my patients is between 20 to 40, 45. And I have seen a couple of people with 45 that never been to a physio. That's lucky. It's good. But once you're there and you see that there is a couple of things that they should have been to a physio before, but they haven't.
Don't tell me about it, man. Right. I'm 35 and I've never been to a physio before.
You went to the Pilates.
Yeah.
Because in Brazil,
it was an experimental class, never taught Ankit.
Could be,
But yeah. So you're doing, I know you study a lot. You're always doing a lot of things. Every time I talk to you, you're doing a new course. What the fuck?
I don't know. I think my brain doesn't like to be quiet.
So what are you up to at the moment?
So at the moment, I'm doing my master's in primary care and orthopedic medicine in a UCG, which is a master that does work with the musculoskeletal issues, but I also work in the whole healthcare primary care setting, which is we do learn about obesity, we do learn about other things like women's health, we do mental health, we see the patient as a whole,
because it is
not only the muscular tissue, so it's very good.
It's like you're fixing something, and then if something else is not fixed, it's going to be...
But Mara told me that the problem you're solving is mobility.
He solves a lot of problems, but he also does
the majority of my patients are with mobility issue, but within that issue, there is a lot of other issues behind. Sometimes you have high blood pressure, you have diabetes, you have asthma, you have mental health issues. So with the master is giving me tools to help people on behind the scenes on how to refer to a mental health facility, who to look to, how to look at the medication and say, oh, that's a polypharmacy, you should address this, reduce the medications, because that can affect on the mobility as well.
So let me be clear here. Let me see if I'm right. Is this your enemy? Because the phone, because people are always like, oh, I need to do this and that and like this.
Yeah, that's not my enemy though, because helping me to pay the bills when you guys have the problem. But it is a problem.
Is it?
It is
How
a problem.
big is it of a problem?
Well, I think in the last couple of years, I haven't seen a lot of people with neck pain more than before. I would say before was a lot of low back pain. You have pain going down to your legs, but now it's a lot of neck pain. And you can see people with the neck forward with that posture.
Bico de papagaio. What's the name of it in English? And then I'm fixing my bico. That's
a spore on the vertebra. Okay. It's just a little bone that grows on the vertebra because the ligament is pulling the bone. And instead of regenerate as a ligament again, regenerate as a bone.
Sounds nice, huh?
Yeah, it's like a little horn.
Cool. By the way, how
but that's not a big problem, though.
Okay, so it's okay.
Yeah.
You're safe.
That's fine.
I have another question.
Yep.
So imagine a guy in his mid-30s driving Monday to Friday.
You're not talking about yourself.
Never.
So, like I have a friend.
Okay, now that's very good. You no name the patient.
Exactly.
Ethics first.
So basically, Monday to Friday, waking up at 4 or 5 a.m., going to bed at 8 or 9 p.m., carrying sometimes a ton of weights,
package.
Like loads,
goods,
loading, unloading, driving, and you know that vans are not made like tailored for each individual,
yeah.
So it's a piece of machine to make profit for the company.
Okay.
And what's the
also the car is not made for
the car.
Yeah.
No, but this friend, he drives a van, so
right. Okay, go
so
ahead.
basically, how concerned should this friend be, and how can you put like his reality?
As a driver, I stay in the car sitting for a long period of time. Someone that work with computer that sits on the chair for a long period of time need to be concerned about mobility and strength, right? If you're long hours in the same position, you should get up at least once every 2 hours. Get yourself a little stretching. Get yourself a little mobility exercise to not let that muscle get weak or get shortened because you're not using it. You guys have a pain that's bothering for quite a long time, and then when the pain gets worse, you go and see the physio. And
That's
then,
the question, because this friend of mine, he's not feeling pain yet, but he's afraid that if he doesn't take it.
Yeah. What I take into account is how is the lifestyle of that person, right? Mm-hmm. It's active, it's doing exercise, it's doing some sport activity that he likes. Mm-hmm. So then I try to incorporate those exercises on the agenda that's already there. But when the person is not, then that take a little bit longer to get the person into the exercise routine. So it starts very small, 1 or 2 exercises, just for you to get used to. Because sometimes we do put a lot of pressure to say, I need to do exercise 5 days. No, you're not going to do that.
Make it. No, and you're going to get frustrated, and it's going to be even worse. So let's start,
do 5 minutes. Do what you can do until you see the importance of that and go from there. So it's slowly but surely you need to start doing something.
Would you say there's something like, if people in general, like depending on what they do, if they're sitting and driving the whole day, or if they are actually carrying things, or even sitting in front of a computer for a whole day, whatever the routine, their behaviors, because of how they what they work with, however it is, would you say every person should, maybe in the morning or maybe before bed, do kind of a sequence of exercises that tailored to their body needs? Or
let's make a very simple idea here. If you're going to be a runner, you train for a run, right? If you're going to be on computer all day, using your hands, using your neck, you need to train to do that all day. Mm-hmm. Sport is also our work for someone, and work for us should be also a sport. Mm-hmm. Yeah, so just to balance out those things.
Yeah, that's another question, because this friend of mine, he keeps on worrying about should he do exercise or not together with the job, because the job is somehow massive.
I know it is, but the thing is, a lot of patients. I have a lot of Brazilians that came here and start work as a cleaner, and they used to work in the office in Brazil, and they get a lot of pain suddenly. It's not suddenly.
Yeah, of course not.
They say, oh, but I do exercise, I go to the gym also. But are you doing the right exercise in the gym that's going to help you to be bending, to be lifting, those kind of things? Yeah. So it's kind of, you need to mimic in the gym what you do on your day and build up the strength from there.
Even to do nothing, you gotta be ready to be in bed, Yeah. No, I'm joking.
Yeah. No.
Well, because you can't be in bed. You're gonna have other issues.
Yeah. Don't do that.
No, but talking about differences now, we kind of had a quick conversation about it, and it's very interesting that you're saying that your masters, you're actually learning departments that Ireland has.
Yeah.
They, depending on the case, you can actually forward those people so they can have a more complete and tailored, they have a mental, straightforward. They should have to help. They should have a mental professional supporting them, or they should have another kind of doctor for something else. And I was saying that I find it a little complete absurd, which I do, that for me to go to, let's say, how can I say that? Specialist, yeah. I would have to undergo through the GP first, and you're saying basically you're the GP of physio. That's the procedure.
Yeah, the primary care idea is that I'm a filter to refer people to the right people.
Oh, okay.
Right. If you have an injury that is not clear, a broke bone, that you should go to the hospital straight away, you go to me, and then we do the physio. Or you have a back pain, it's not yet giving you loss of sensation. It's not yet giving you the loss of bladder and bowel control. Yeah, you should go to the physio, that we're going to address the issues. And if you show some symptoms, I'm going to send you straight away to the person, like the GP does. Because I am already working on the recovery of the symptoms.
Yeah.
Do you understand?
Yeah.
So that's the idea. It's already what I do before the master. Is a lot of Brazilians coming here, they don't have the language and the language skills to go to the doctor and say what they want. So they go to me so I can write down for them what they should ask and what they should say to the doctor to make the issue clear.
I understand it's useful. Well, it's just something that I really need to say about it.
Say it. Say it, woman.
I understand it can be useful depending on how the situation is. That some people actually don't know what they need. And some people need some guidance and need to be pre-evaluated or whatever it is, or they don't really have an idea, but it is kind of stupid. I'm sorry, I'm going to keep thinking it is kind of stupid that if I know I have asthma, I should be able to go to my specialist instead of paying for 5 different doctors to get one inhaler. You know, like it's stupid in my...
Really.
That can be costly as well.
I don't know. It's very costly.
Frustrating, costly.
Hold on, guys. It's not like that.
Oh my
it's
God,
not like
no,
that. If you have if you have asthma as well. So if you are in the health system, the Irish health system, you're going to have a nurse that is looking after you for that. It's a community nurse that's going to come to your house. It's going to see your medication.
I don't need to go.
Normally. Yes, she's going to teach you how to use the inhale and address those issues before you see the specialist. It's only need to go to see a specialist in special occasions where you either need surgery or you need advanced treatment. And there is a lot of advanced practitioners like nurse, physios, and other people in the system that can help you to fluctuate through the system without the need of overloading the specialists, which is 1 or 2, is not many there. So let them take care of the serious stuff.
Who's really, I know, but I like doing my tests every year. So every time I go back to Brazil or even to Portugal, I do my tests. Like my doctor in Brazil has everything. You know, that's
brilliant. That's really good. You're looking after your health. You try to predict those things, but it's a cost. Here they try to do everything through the health system, which is no cost for everybody. So that's no economic sustainable to do that way.
Of course, I know.
But once you have the real problem, they're going to invest everything they have on you. It's not that they're going to hold because you have the problem. Once you have the problem, they're going to do everything they can.
Like the Jurassic Park founder, no expenses spared. Yeah.
So it's kind of tricky though, because we came for a health system that is really good. The SUS is one of the best.
In Brazil,
the SUS is the Brazilian health system. In
it's
theory,
like SOS, you know.
SUS is the Brazilian health system, which is amazing. When you start that, is definitely health for everybody. Here is amazing system as well, but I have those barriers before you get there, which is totally understandable.
Yeah, it's like a journey. So you gotta point the patient to the right direction.
So they have the idea here of best practice. For example, if you have a GP, there need to be a GP which are a certain distance from your house. It's not like I live here and I have a GP in Tala. That's not the best practice. So they have those measures as well to help people in the community to be supported on there.
What if, like, my GP is in the city center? I was living in the city center. I'm not going to change my GP.
You know, but that's a unfortunate situation. That's a tricky situation. But normally people, when they buy a house here, they live there for their whole life.
Of course, I get it. Okay, makes sense.
Yeah, and Mara, you as you said, you go to Brazil or to Portugal to do.
I do have my doctors in Brazil, but I do have a GP that I really trust here, and if I have a problem, I'll go there, and I'm sure he's old school, so he touches you like, do you have pain here? And
brilliant,
I don't want to abandon this.
Not like the GP I went once and I showed her something like, oh, that's nothing. Oh, so what's your name?
Just say paracetamol.
Where's your money?
Oh, shut up, Mara.
Paracetamol.
No, I'm going to say something very funny, and you don't have to say anything about it. There are some stories that we all know that people go through, but this one is great. A friend of mine, he had a problem, and he was feeling the pain, and he didn't know what it was. And then when he went to the doctor, I almost said vet, I'm sorry. And they gave him whatever in the veins and stuff. And at some point, they said, look, we think you have appendicitis. What we're going to do is we're going to open you up. If you have appendicitis, great. If not, we're going to close you and then figure it out. And he of course, freaked out, and he was about to go to Brazil a couple of days after, and he just literally removed everything and just ran through the corridors.
Oh my God.
And the blood was spilling. He went back home, went to the husband. The husband, of course, called him crazy, and they flew to Brazil, and the appendicitis had exploded. They went straight away to Swish. Swish. And the thing, whatever was exploded, and the guy said, I don't know how the fuck you're alive.
Wow, so let's run from Europe and go to Brazil to get help.
But my point is, which doctor in life would just say, we'll open you up and see what it is. And then if it's okay,
the first doctors from the beginning of it.
From the other side of the story, I can see that the doctor said that at the point of view of diagnosis, sometimes you do open a patient for a diagnosis point of view. Okay. Sometimes, for example, let's say for back pain, sometimes we do the injections on the patients. If the injection didn't work, that gives us a diagnosis.
Okay.
It's not that, it didn't work, it's not worth it. Yeah, for the fact that it didn't work is a diagnosis.
Mm-hmm. It should have.
Yeah, so that shows what is happening because it didn't work. Mm-hmm. So tricky. Maybe the doctor tried to say that, and
maybe he was. He was in pain.
Yeah, we don't know.
Yeah,
you know what I mean?
But that's the story he told me.
Yeah, I know he freaked out. I know. It says why.
It was a bit crazy.
I understand both sides. But he should get the surgery here.
You should have gone, but okay, I wouldn't let someone open me just for the sake of it.
No, it's not for the sake of.
I know.
It's a good story.
Yeah, I know. It's crazy.
Yeah.
I'm seeing him running the hostel like, oh my God, he should have been in the mental hostel.
Like Bruce Willis in a movie or something like that.
Yeah, oh my God. Yeah, no. Yeah.
What is that you like the most working with? Mm-hmm. What is that you like the most working with? Because you do a lot of mobility, but what do you like? What do you enjoy?
Oh my gosh, I love everything.
Really?
Yeah, I do love everything. But I have to say, what I most get, how can I say, proud of is when the person has a back pain and they came to my clinic like limping.
Wow,
you know,
I saw one that you posted.
Yeah.
The man was like a square.
Yeah.
And he got...
Then I do my thing and then they leave walking, smiling. Oh my gosh, I got shivers now. It's, I should get overwhelmed.
Of course.
Yeah, sometimes I still don't believe it. Oh my God, yeah.
But you have to make it very clear that it doesn't depend just on you.
No.
It depends a lot.
It's
like
it's a teamwork. It's a teamwork. It's what I say, like, because sometimes people try to go to a chiropractor, to a massage therapist, to an acupuncture, and they think that's gonna save me. No, that's the technique that's gonna help you. What's gonna fix all the problem is a mix of behavior and safety measures and
everything,
the techniques. It's not only that. And sometimes you do get the person right, and for example, they go to a chiropractor, do the manipulations, okay, off you go home. But I didn't teach you that if you move that way, you're going to trigger that pain. And then you go back to the behavior that trigger the pain. And you're back on the pain.
You have the do's and the don'ts as well. Yeah.
So
the don'ts that I know, it's the
thing
you do.
Everybody that comes to me is, I do all the things. Oh, you're amazing. Yeah, but there is homework there. You know that.
There is.
There is always a homework.
I used to think that pain in the gym would be enough, but unfortunately it's not. Yeah. And then sometimes
there are many types of pain for your health. So it's gonna be alright.
And sometimes not only pain though. Sometimes it's just
no pain, no gain, right?
No, please God, no. I say to everybody, you're here to feel less pain. Yeah, that can be a little bit painful sometimes. Can be a little bit painful.
Yeah.
But you shouldn't go to someone else to feel more pain than you had.
No, talk about life. No pain, no gain. Then you go to...
And he goes philosophic.
Then
very good,
Just go to Igor and sort yourself out.
No, you're going to feel pain sometimes. Sometimes I have to go deep. And it's a lot of cheers before they smile.
Do you have fun, like making people cry or like?
Oh, he made me cry already.
Yeah.
Yeah.
I do make cry, but I make laugh at the same time. But I do make laugh at the same time. But yeah, sometimes it's the person is so bad, right? It's a lot of, it's not only the pain, it's everything is so bad.
Yeah.
Do you know what I mean?
The whole context, like life is not going great.
Yeah.
Many things going on in your mind, and
That's probably
you have to make room for Christ, though. You have to make room for the person to express themselves, and then we take action.
Sometimes the body gets tense when the person is. Yeah. You have to. It's a complete work, actually.
Yeah.
What kind of cry was that? Like, why I didn't do this before?
There is.
No, because sometimes there are some stuff that are painful, and that's the process. But then you get better.
You do get better, though. Yeah. You always get better.
You have to get better.
Yeah, you do get better. But it's funny because sometimes people came to me saying that I am working a lot, I've been doing those things, and I decided to change my life, and I went for and then my knee starts hurt. And it's okay. When did you run last? I never run.
Oh.
So now you understand why it's a pain.
Yeah.
Sometimes in the conversation, I give them their own answer.
No,
You were just a mirror.
Yeah.
They said it was gonna be healthy.
Yeah, it's like I'm a Virgo, so I'm very organized. So people start telling me something, then they put the box and give them back. So
open the box. Surprise. And what is the case that you were surprised the most? It can be here in Brazil, and then where was it?
Oh my God,
that you were like, I didn't know that would be so fast, or the person actually did so perfectly, or it was a tough job. Something
or
that the kind of.
There is so many.
How is this person still alive? This kind of stuff.
How is this person alive?
No, in Brazil, I used to work with neurological rehabilitation, which is very challenging. Very challenging. And I had a patient that my goal before coming to Ireland, before buying my ticket to come to Ireland, was he needs to go back walking before I book my ticket. Once he's walking, I can leave Brazil.
Okay.
He was hit by a car walking the street, and he lost half the brain. And he was with me for 3 years, 3 times a week, physio. And his wife is a doctor, and she really invests on his rehabilitation. Not for the point of he's not going to get any better, but she wanted him to get up, to bring the daughter on the aisle. So that's kind of stuff that I'm most amazed. It's not for the wedding, no, for the graduation.
Graduation,
yeah. And
this kind of stuff, like if you're
it's not for the walk.
Yeah,
it's for that particular moment of someone else's life that I see my job valued. So it's not the case. It's what is the case with that. In Ireland, for example, I had a non-Brazilian patient. She's from Europe, and she was in a lot of pain, her shoulder. And she had to stop work because the shoulder wasn't moved.
Was she doing something physical for work?
It's called frozen shoulder. It's this that doesn't move. And she went to me, said it's a very painful rehabilitation. Very painful.
I can imagine,
Yeah, it's very painful. And she took on my advice, and we team up for that. Said it's going to be hard, but we're going to do together and all this kind of stuff. And in 3 months, she was lifting her arm again and went back to work and went back to life.
Oh, yeah.
Yeah.
That's something.
But that's the thing. She was already depressed because she was losing work, because she thought it was the shoulder.
Yeah.
And that tense was giving more tense to the shoulder and the neck.
Yeah. Was she working with something physical that she would actually have to have her shoulder?
Not too much physical, but physical.
But somehow.
Yeah. Physical somehow, but not much. But that's the thing. It wasn't me to going make her to move her arm back was her getting her life back.
Yeah,
That
of course.
most impressed me.
Yeah.
Of course, that's a nice story as well.
That's
It's
the
very,
story.
it's a very
It's the story
serious
behind the bones and the
Yeah.
muscles. That's how I'm
people's
fascinated about.
lives.
Yeah,
And you are a very people person.
I am.
Complete. And you have this thing in you that you pass calm, tranquility, and you make us understand that it's going to be okay. Even if you
it's gonna be
don't talk
hard.
much about it.
Yeah.
You say it once or twice and you do your funny stuff. But we have a feeling like that's going to work. I trust it. I trust
You're by
you.
your side.
You know?
Oh, if it's not working, I always say like we have options before. There is always like if we're gonna try this, when you come to me, I'm gonna say that's phase 1, phase 2, phase 3. You have probably a day to get out of me. I always joke about it.
Yeah.
You're gonna get rid of me very soon.
Yeah.
But I think it's
Any patience
And
thing.
that's the dream. Because
Yeah. People always think, no, let's book a package of 10 sessions. God, please, no. You're here 10 times now.
it's a long friendship.
No, Jesus, I'm
start of a
failing.
long
Where
friendship.
I'm
I need to be
failing.
seeing different faces.
Yeah.
But I see, like, I'm not a father, but I imagine that if I was a father, I wanted to be willing to, fuck's sake, I would be willing to be able to carry my children in the future. That's what I say. So,
And clean your own ass, right?
Yeah.
Do you want to take a shit and ask someone to clean it?
Clean your
Yeah,
ass,
yeah.
take your shower, go walk and take your stuff. You know, how do you see this? Like, what age do you see the importance of getting prepared, getting started? Or it depends on the individual or the
So
habits?
let's say something, right? After 30, we are on the way out. So we're losing more than we gain.
We're doomed.
So we need to start weight training. That's
Sad.
the
It's
rule.
not sad. I mean, at least we have an option.
No, at least we know now.
Yeah.
We know now that after the time of our life, we need to start to lift weight to help to age better.
Yeah.
There is a lot of studies now saying that the size of your leg can predict how good it's going to be your
The muscle, yeah. The
your,
sense of
your
muscle.
age,
that,
and
man. Look at me.
also for
I'm screwed.
Also for dementia, they're showing that the strength on the legs prevent dementia.
Yeah.
There is a nice program on Netflix. I think is the Blue Zone. What they shows parts of the words that have the majority of people which 100 years old.
Oh, yeah. Japan, some places
So they have
in China.
Japan,
yeah.
they have in Italy, and if you see those kind of things, what I took from my point of view of physio is all of them is squatting.
Oh,
Or
yeah.
they're going up the hill.
Or they sit
using-
down.
That's true.
Yeah.
You know what I mean? So,
That's true, because once I started like squatching to carry the boxes and like do the proper stuff, I was
You got a nicer
imagining I was-
butt.
Yeah, I was
That is
imagining
all.
I was at the gym. Exercising my butt, so and people
Yeah.
were staring at me. No, but
staring forward though.
Yeah.
yeah, it's very important. Scratch.
But I saw that's quite important. Like my parents recently, they started doing Pilates.
Very good.
And I'm like, very good because it's low impact.
Yeah.
But so you put some effort on it. And come on, let's face it. They're starting a little older than they should. I am starting a little older than I should. But still, it's something. It's better.
Yeah. We need to keep moving. That's the thing. It's very, very, very easy to get in the comfort zone in everything in our life. It's very easy. Let's change a little bit the subject. We came to Europe, or we came to live abroad. We left our comfort zone, and as soon as we get a better job, we say we're not gonna walk again. We're gonna take the bus. We're gonna get the car.
Yeah, true.
Right.
And it's very easy to get back on the comfort zone. And comfort zone is not a very good place to be.
Never.
It's comfortable, but it's not the place where you're going to grow.
Yeah, no,
In
it's
any
not a place for you
sense.
to
No
stay.
leadership, no nothing over there. Just like the same stuff. You have everything under control.
So that's the thing, though. We need to think it's too comfortable. It's nice, but it's not the place where I should be.
Yeah.
Of course, yeah.
So do you think it's like it starts from here? so you can reflect everything in your body. You can start changing your body from the gray area. The
gray area.
I think it's both. It's
yeah.
mind, body, and soul.
Yeah, you have to be connected.
Yeah,
there's no
everything.
way. Yeah.
And the environment, because people around us, most of the times they don't want to work out. They don't want to have a good.
But do you work
diet.
out for people, for you?
Yeah.
No, but what I'm saying is it's much easier for a person that is seeking for discipline to find in the environment.
You don't need to be so disciplined. You just need to be consistent.
Yeah, but to be
once
consistent.
Once a week. Do a good exercise once a week. That's fine.
If you can do 2, if you can do 3.
But what's the tip for that
The
person?
idea would be 30 minutes a day.
30 minutes. But what if the person doesn't even brush their teeth or use the dental floss?
Oh, man.
What do you say to this person?
Oh, man.
That person probably have a nurse beside them.
Or it's a bad nurse because they still don't
If
brush.
they can't do, probably someone else is doing it. But yeah, for a person that's very, very, very lazy to start.
Play video games. At least you're exercising your brain.
Yeah.
No, but get started changing their body. What?
So if the person is doing nothing, there is a problem mental health issue there that should be addressed. So starting first, find psychology to help navigate on that. And once you understand what's going on inside you, then you go to the personal training to do the exercise. Or if you don't want to talk about it, go at least for a walk. I think the walk is the easiest and the best exercise for everything.
It's for depression as well. People usually
30
say, "Oh, you're
minutes
depressed,
walk.
go walk."
But it is.
There
It
is
is
a
because it
study.
starts to release endorphins and that starts to clear
And
your
there's the eye
mind.
movement thing. There's a study that says that when you move your eyes to the side like this, when you're in the REM phase of the sleep, for example, as well, you're moving your eyes, your brain gets more active. That's why you have dreams and usually vivid dreams. But when you're walking, you tend to kind of look to the sides, and then your brain does the same thing. It activates the same areas of imagination. And so it's important for you to be, that's why when we talk to people and we walk, is what's the name of it in English that they call it walk and talk, right? So when you're stressed at something, you just get up and then you just walk through the corridors of a company sometimes and talk to someone, and then you're talking, activating your brain in that region, which I don't remember now what it is, but it releases, of course, the endorphins, but it helps your brain to produce more information. So
Serotonin and
I like what you said about. But are you working out for the people around you or for yourself?
No, I work for myself now. I used to work in hospitals and clinics, all the stuff. But now I'm only in my practice. It's kind of very lonely place, even though I see a lot of people in the day, because only me.
Yeah,
it's only me. I'm the secretary, the cleaner, the market,
you do everything.
I do everything, and I should do the research.
Doing it differently in the future, like you're planning on expanding, or you're happy where you are, like with the results.
Very
you are?
Happy where I am.
Yeah,
but of course, it's gonna come a time that I can't do much. As I do now, because it's a very, very manual job. Mm-hmm. So
there's a limit to that.
Yeah, there's a limit to that. I might go for the teaching part, which I did in Brazil, but then I had to stop.
And you enjoy it, right?
Yeah, I do like.
That's really interesting because I'm learning throughout the process of producing the Setcast. How important it is to keep ourselves in movement.
Yeah, updated,
and we need people around us because we think we are comfortable in where you are, but actually we're not. We just realize that we want more. We want to impact more, and learning and teaching makes me learn more.
When I have to show to the patient what's the test that I have done, what's the diagnosis that came and what we're gonna do, that get fixed in my brain to the next patient it's easy. Sometimes people think, oh, you're very quick to diagnose, but it's been practicing for years to get to that point to say, okay, that might be that, or that.
Yeah.
It's like Picasso, the painter. He was once in a restaurant. There's this story, and he was drawing on a napkin.
Yeah.
And then he was just throwing it away in the bin. And a person took it. And they were like, oh, it's so beautiful. And he took it back.
And he was impressed because it was so nice.
It was so fast, so nice.
Yeah.
And he was like, no, this is like more than like 4 decades of working. So it's not that easy, Yeah. It's easy now, but the past.
Yeah.
But talking about the learning process, this is actually the best way for you to learn actually something, is to be able to explain it very easily in a way that anyone would understand. So there are 3 phases of the learning, like the 3 ways for you to kind of learn: studying, and then the other one, but the one that sticks it to your brain the most is when you explain it to someone in a very simple way.
Yeah, that's another challenge for me, because I do learn in a very specific way, and then I have to bring that to the patient in another language, which is the language that you're going to understand. So sometimes
language.
Yeah, you talk with me in Portuguese in the clinic, and I'm typing English. So, you know, is a live translator there.
Yeah.
And then people sometimes take for granted. They take for granted that I'm there translating everything 100%. They take for granted that I'm gonna send a letter to the doctor. They take for granted that I'm gonna refer them to do the MRI. I'm gonna be responsible for the MRI that I'm asking from them.
Yeah.
Do you know what I mean?
It's something else. It's not just like physiotherapy.
No, it's everything behind. Sometimes people take for granted when you go to the healthcare professional. They try. I took years to get my license though.
Yeah.
Do you know what I mean?
And you still get specialized every time.
And there is that kind of knowledge that people don't have behind. They just think, oh, you're physio in Brazil, you're physio here.
Okay. And of course, I understand, like, at least in my city, you probably have more for physiotherapists that you have in whole Ireland.
Yeah.
So it's like, not everyone is as qualified there. Not everyone, because it's just what it is.
Yeah. So I wish the people become more aware of the professional that you're going to.
Mm-hmm.
Yeah, okay, yeah.
Yeah, we've noticed that, like, bringing people here over to be interviewed, that they're always concerned about look after like yourself and find the best professional. Get references, see if this professional is making sense. Because it's easier nowadays to get
with
somebody...
social media, my God.
I mean, you can Photoshop the certificate that you know, like,
not even that. That's very extreme.
I know.
That's very extreme.
Certificate, man.
I know, but...
I mean, like, you should be aware of, like, some people say they are something, but they're not. Like, they're professional, but they're not.
Yeah, true.
That's true. An accountant here in Ireland. The guy saying that he was an accountant, but
that's the thing. Social media is good, but at the same time, it's very bad, because most of the people that get to the media is not that they're showing. Do you know what I mean?
Yeah, of course.
It's not that they're showing. Do you know what I mean?
Because like they're showing the best version
of
themselves
like
all the time.
50,000 followers. Mm-hmm. How many of those followers are real people?
Yeah. No. True. Or sometimes they're just friends, and then friends of friends, and then they do not. Yeah.
It's not the real crew.
No.
Not the real crew. Yeah. I'd rather have like 1,000 followers, but they really follow what's going on, instead of 50,000 that they're just paid to make numbers.
Yeah, that's a lot of
potential. It's a commercial. It's very commercial.
It has a short life span, because after a while people realize, and then they go to the serious professional.
Yeah, I know. Yeah, that's something that I have notes.
Do you think people are more aware of what professionals here?
What happened with when I say my story? There is a lot of people that are doing the job that is not enough, but they get the credit for it. And once the patient see there is no the ideal, they come to get the real fix.
Yeah, I know what you mean, because I went to my dentist to
Let's
do
say
a
simple
cleaning.
thing. A lot of people go to get the coping done.
Oh yeah, okay.
Get a lot of
The
coping.
cupping.
Oh yeah.
And you go to get the coping done thinking that's the treatment for you, and you're now being
or they kind of self-diagnose and they say, I need cupping.
yeah.
And they have no clue what the fuck is going on with their back. And it's sometimes
And they keep
something
going
more.
to coping
Yeah.
until
Just addicted.
4 months, 5 months later, they realize there's no fixing. And then they go to
It's like actually even worse because it's hiding the true cause.
give a short-term relief.
Yeah.
But that's just one of the things. But it's sometimes it's a lot of health problems that you just go for the quick fix. Quick fix is never the solution.
No, it brings more problems than solutions. So, and then you need to
question
spend
yourself:
more.
is a quick fix? Is a process to get fixed? Okay, it's something that's more valuable.
Yeah.
Yeah.
It depends on what you have, of course, depending on the cause. Sometimes cupping can be...
You're gonna buy your clothes, right? Get the cheap one. You're gonna wash. It's gone.
Yeah. The color is gone and it's going to be ripped.
Yeah.
I wanted to ask you so much something.
Yeah.
What can you see like for those How to Academia people, those people that are lifting heavy weight and stuff, which are the lesões?
The injuries.
The most common injuries that you see in those people that know so much of what they're doing.
All of them get the shoulder.
The shoulder.
Wrecked, yeah.
My shoulder's not because of that, I promise.
No, yours is different. There is another problem on the line. No, they are fucked up the shoulder.
Yeah.
They are fucked up the shoulder.
And the women, do they have the knees or something fucked up?
The knees, when they start to run. They start to run crazy, and they do a marathon, and then after the marathon they're gonna go for 3K run.
Whoa.
And they feel the pain, the worst pain ever.
Of course.
Such you've been doing that for a long period of time with your hips. No.
Oh yeah, and like like
the problem is not your knees,
like
the
that,
hip.
The
Do they
hip.
stretch?
Sometimes they do the stretch, but sometimes is the knee go inwards, and they don't see that. But they have a strong muscle, so you won't feel the pain.
Oh,
You're gonna feel
that's worse,
afterwards. Huh? Yeah,
because you just go.
You just go. Yeah,
humans are very tricky.
Yeah, it's
a very piece of tricks.
It's like too much or too little is never good. That's it.
Yeah, there's a balance for everything.
It's always a balance.
You're gonna drink. Have some water.
Yeah.
Don't drink too much.
Yeah, you're gonna run. Have some rest.
Have some
water
rest.
as well. Have some water.
Rest is the runner's water.
Yeah. So that's the thing, though. That's what happened a lot. And what happened a lot here is, now, that's funny thing. People, when they come from Brazil here, and they go to the clinic, I have excruciating pain in my legs. I think I'm dying. And then I do the assessment. And I see it's just a strain on the cuffs because they've been walking. Because they didn't walk in Brazil, they just drive.
That's true.
Yeah, so it's just a chin pain here. They think they have a broken bone.
But it hurts. This one actually hurts a lot.
It does, because I had the same pain at the beginning, but I knew what it was.
We were talking about it earlier on. Like we arrive here, we start walking and this and that, and then we are in a better, comfortable situation. We buy a car, and that's it.
Yeah,
back to the square one.
Yeah.
Back to the pain.
Back to the comfort zone, getting worse. But it's gas, sometimes it's all. It's a good thing and it's a bad thing. You hurt yourself, but the good thing, you walking.
Oh yeah.
Yeah. And you're gonna get used to it at some point.
Yeah. That's when it's gonna go away.
But then if you overdo it, it hurts again. Then it's
like
Just bring the person to Igor. That's it.
just
Igor,
bring it.
he
Yeah, I
doesn't
highly
have
recommend him to everyone. But then people are just like, "Oh no, I'm gonna be okay," and it's like, "Yeah, you will. Just whatever."
when they
you
go
were,
worse, they always go.
So you're his patient.
Yeah.
Are you?
I still am because we still have some things to fix, but
Always.
we're just giving it. I'm doing it a pause because of other stuff. But yes, there's still a lot of things to work on. But yeah.
But like quick answers, like make a list of priorities for a person that want to get started in physio. They got the message, they are aware of it, they understand that they have to get treated or looked after, so they can have mobility in the future. They can carry their grandchildren,
Yes, well, that's a tricky question though. But
I know.
Yeah, I think do not overestimate the pain and do not underestimate the pain. Right? Sometimes you have a lot of pain that I think is the worst. Sometimes that's not the worst. If you see the professional that can make that clear for you, don't wait at home thinking.
Depending on what it is, it can get worse.
Don't look to Google.
Yeah.
Please.
You're not going to die.
Google is
it's not
not
cancer.
Don't look to Google.
Yeah, Google is going to give you cancer for all the occasions. Oh, you got this and this. Oh, it's cancer for sure.
Yeah.
Oh man.
No, it's funny. Especially the young people that they are raised on Google.
Yeah.
So they look to Google.
It's ChatGPT now.
ChatGPT came to me with the whole diagnosis.
Yeah.
And then I do my test and then, I didn't see that. Yeah.
Google doesn't say that. That's called experience.
That's the difference between real and the Google.
Yeah.
And that's why
it's like people with the GPSs back then in the past, and like the beginning of the GPSs, they used to go to the favelas and end up in wrong places.
Don't be amateur.
Just relying on the technology blindly, and that's it.
It's still nowadays.
True. It's just a little different, and not always put yourself in so much problems as it would if you go into a huge little favela. But
and it's the same. Which don't underestimate the pain is you have the pain and you have a restricted movement. That's an issue that should be addressed. Everybody should move freely.
I have heard more than once that shoulders are made to turn, so people should be able to
rotate
the shoulder.
What happened to human life, human beings? Like, what's wrong? When we started doing things wrong?
When we started to do things wrong,
stretched and like because moving. Hunting.
The technology starts to get us in the comfort zone. Everything's made for us to do less.
Yeah, true.
We started addressing comfort for others. Your food,
I can do it for you. To use the Bluetooth to press here, to not get up to get water.
They don't have even to press the button to like the switch for the lights anymore.
The curtains. Press the curtains. Don't get up.
True, Alexa.
So that's the thing, though. With the technology, it's there for help. It's not there to do all.
It's not there to abuse,
do not abuse. Use carefully.
Yeah.
You know what I mean? It's very good. Sometimes you're tired and then you use that. That's fine. But at the end of the day, you put the little robo to do the hoover in your house. You stop to doing the hoover. You stop to move.
I think sometimes it's actually like for me, I have my Alexa in my room is connected to my lights and everything. And then sometimes I'm actually doing some stuff. And while I'm doing it, let's say I'm folding my clothes, okay? Or trying to organize my wardrobe, which is always a mess. And then I ask Alexa, just turn the lights on or put something to play or tell me a story in that language and I'm talking to her and she's doing stuff to me so I don't stop what I'm doing at that time.
Yeah, that's using reasonably.
Yeah.
I use it a lot, but not.
But it's like, okay, if you have the robo, the robot,
cleaner stuff.
The hoover there is a robo. And using that to go to the gym and go for a walk and dry clothes is fine, but using that while you lay down on the couch,
scratching your balls,
doing nothing. Come on.
I ask myself, like,
you're gonna have to pay that later.
Oh yeah, But robots, like we're gonna have robots in the future, right?
Yeah.
We have
Just getting out of the context. What about the robots that are gonna be out of homes? Are they gonna be hobos?
What?
There might be. Depends.
They
You know?
might be
Que?
robots. They're gonna be hobos,
Robots.
like hobo, homeless.
Meu Deus.
Eu sei,
It's a bad joke, isn't it?
it's a really wrong joke. We need some content for the gray ones, you know.
Okay,
Yeah.
that's true.
You forgot it yet.
You're a content creator. Oh man, because we do kind of
I'm a content creator.
we do some shorts, some cuts that we
Yeah.
put grays in the middle of just, and then that's stupidity like that comes up. And
Good. At the end of the day, left and right is gone in my mind, because when you go to the room and you lay down on the bed, your right is my left, right? So sometimes I go to the
Yeah.
right leg and a patient asking
Lift
me,
your left foot.
it's me, but you know it's the left.
the way-
The other left.
Yeah, then I said, no, but I'm testing both, but I tested already, so of course I'm not testing. I just forgot what's left and right. Thank God no surgery. That's why in surgery
Yeah.
we do make this is the leg.
Yeah.
Because we do
Right,
get
yeah.
confused.
This is the
course.
this is the
I
head.
do get confused, totally.
At some point, because you're exhausted.
sometimes because if you lay down with your head here, that's your right. If you lay down with the head, the left is the left.
Because come on, you're the whole day communicating in different languages, and you
Yeah.
have to write in one language and talk to the person in another language. At some point, the machine here
it
has to
doesn't work.
stop.
Your gray area is gone.
No, no. I remember in Brazil, I used to work in the ICU, so I used to take night shifts. And at one point, I did, I think was 48 hours in a row.
Have you seen ghosts before over there?
Was kind of,
Jokes.
you know what happened? I was talking with my friend leaving the job, and then I go into his car. He gave him a lift home. I woke up the next day. Where's my car? So someone else robbed my car, and then my dad rang me. Okay, what's going on? Igor, what did you do today? He said, oh, I drove to work. The guy's work.
It can be stressful sometimes.
But I think what was good, why did you drove? Couldn't have a hit.
Oh man, that's tough
crash the
because
car,
you're
yeah.
you're so overloaded sometimes.
The guy cures brains and
Oh yeah, imagine that. But that'll happen. Like, I think we all get to some point here that we forgot everything after a long day.
Oh yeah.
Yeah, because sometimes you're speaking in a language that's not yours. It's, oh my God.
Yeah. Then
Loads
the
of
brain is
information.
selective,
Yeah.
right? Whatever you have, you
Yeah.
need to execute whatever you're executing now, your brain is
Yeah,
going to try
I
to remember and it fogs the other
I
stuff.
remember at the beginning. Now it's more practical. It's easy. At the beginning, I was more tired to listen a lecture in English than I was working the whole day.
Because the focus and the
Yeah.
energy. Yeah. It's a challenge. That's something good to be sad because people don't realize how tough it is for you to pay attention, that much of attention, because you're going to be working with that and you're going to be working with people's health.
Yeah.
You got to know what the fuck you're doing.
I know.
So the amount of attention you got to put on.
Yeah, my exam on Wednesday, it's 1 minute.
Yeah.
Was 1 minute and 20 seconds per question.
Wow.
Right?
Was it enough? How was
Oh,
it?
no, it wasn't enough. I was like, the last
so
question, for a natural English speaker, yeah, but you have to take into account that sometimes we do get caught on the translation stuff.
And you're stressed.
Yeah, and on the last question, the last line you didn't write, fuck, it's done.
Yeah, sometimes, you know.
It's done, but it's a challenge, but it's good. It's good for the brain. I hope that's going to help us to not have dementia in
exactly.
the
Yeah.
future, because
Oh yeah, dementia is something very important
it
to be
is.
looked after.
It
because
is. Yeah, it's very
people
common
just
now,
they
especially
don't.
with computer stuff. It's people are not training the brain. They're not reading books. They're not doing
Sudoku.
the good stuff. Yeah. We used to do crosswords.
Do the numbers.
Crosswords is
Yeah.
a simple thing. It's not doing it.
Yeah.
No, they're definitely not. They're not even thinking for simple stuff. Like everything is ChatGPT now, and that's an absurd. Everyone's
Mara.
Right, Mara. Come on. No, I don't do that. Sometimes I just go and kind of play. I've been having conversations with the ChatGPT in German
nice.
You didn't become
lately.
best friends with GPT.
No,
Yeah,
just
it's
sometimes.
Alexa, ChatGPT.
And we
Very
talk
good.
in different languages. to
Careful,
kind of.
loneliness is a very serious problem, right?
Very serious.
See, that's how it goes.
How it goes. So we're talking about attention and what else? Yeah, attention. People like the physios that are paying attention at the conversation here, and they would like to become physiotherapists here. Like
So they need to go
something
through-
similar to you.
They need to go through the recognition process to get the license to work as a physio, or go through college here. There's a couple of colleges that you can do physiotherapy here.
Would you recommend college or go through the recognition? Because I've heard that the recognition is a pain in the balls.
You would recommend to go straight to the masters.
Okay.
You
And
didn't go to
after
the
the-
masters.
No.
But you would go differently if you would
No.
get started.
Do as I
Because
say, not as I've done. Yeah.
No, I didn't go to the master because I had the knowledge already, so it would be something that wouldn't fill my needs. But if you just finish your college, or if you don't have any post-graduation as I did, it's a good thing to do.
Yeah.
Go through the masters to get your validation.
Get a piece of paper, man.
Yeah.
that's
it.
And
Yeah.
you also learn at the same time. Do you know what I mean?
The reality of Ireland, because
Yeah.
it's like one thing is working in one
Yeah,
country,
I struggle a
another
lot
thing is work-
at the beginning because I have to study to understand all those things. And I still am.
Especially when you arrived.
Yeah.
The information wasn't that, like, you didn't have.
No, not at all.
Yeah.
Oh, the vocabulary in English, and it's something
Well,
tricky.
everything, because it doesn't matter if you like. When I arrived here, I could already communicate in English, okay, and then, but of course, when you get to the place, there is some little stuff. Then you're like, okay, I didn't really know that I could say that instead of,
Oh, yeah.
and then the vocabulary, and then there's always a new word. Until nowadays, come on, let's be
Oh,
honest.
yeah.
Yeah.
It's a
So,
constant learning.
yeah. So it can be very tricky, I suppose.
Yeah, it is. Yeah. So I would recommend the person go to the master if they have some kind of knowledge, experience prior.
Yeah.
Then they go through the normal process.
Interesting.
Yeah.
And do you have an Instagram page?
Yeah.
So-
Igor Castro,
Yeah.
pain relief.
Santiago from the future, please.
I have to do something about it.
Yeah.
I have to do something about my friends. Like, I really like to look after my friends, you know?
Yeah. Well,
Yeah.
yeah. Can book appointment for your friend. Just go on
No,
Google.
I have another question like, about this.
Yeah,
because
Igor Castro, and then that's a book page there.
In this situation, you would allow him to book it under someone else's name, right?
Yeah.
Specifically.
Yeah, just book in your friend's name. You know?
Yeah.
But how costly can that be? Because, I mean,
If you think you're going to pay for me to go 1 or 3 times, it's fine because you're not going to be with me every week. It's not how it happened. You're going to go with me. You're going to do the assessment, see what's going on. Maybe you're going to come back in 2 weeks. Maybe you're going to come back in a month. You have your homework to do at home, and you have my support to deal with that in the same time. So you might spend 3 times, 3 sessions, instead of pay a package of 10 sessions.
And those 3
that
sessions
you
can last
may
6 months
not
sometimes.
even
Yeah.
need it.
Yeah.
Do you know what I mean? That's why I don't work with package. It's not how it works.
good to know because I didn't know that. Like,
Yeah.
usually people, they tend to like, okay, so you need 10 sessions of this,
Yeah.
you pay this.
No, everybody's different. Everybody
Yeah.
recover in their own time. And it's normally, unless it's a big problem, and when it's a big problem, I always give a discount. I said, look, it's gonna
You're
take a little while. No, it's gonna take a little while. It's gonna take a little while. Your body responds a little slow. So I have the idea of, okay, it's gonna be a little more than we thought. But
Yeah.
normally it's not. And it's normally end up in
Yeah, I mean, the thing is,
6
people
hours.
have to work as well. It's
Yeah,
not just
they
you.
need to- yeah.
You guide them, and then they have to do the shit, which is tough.
Yeah.
Because sometimes you have to repeat things every day, okay? And then
Yeah.
people don't have the time, or they don't feel like I'm not
We
gonna
don't
wait.
want that's why I say it's a homework to bring it to the childhood. How serious you took the homework.
Never took it seriously.
Yeah.
I used to be the nerd.
But you know the value. The value.
Yeah, of course I do. I'm not the fundão people
but now,
anymore.
Yeah, but now you grow up, so you know. Okay,
Yeah.
I don't like it, but I need it.
Yeah.
Yeah.
It's mandatory.
Yeah, it's different than when you work age. You think you don't need it.
Yeah.
And you don't like it.
Yeah, that's true. Do you go to the physiotherapy as well? Or?
Well,
Yeah, that's an interesting
that's a good
question.
question. I try to treat myself because sometimes I know where I made the mistake, so I need to fix. But of course, there is sometimes something that I can't look after myself on my own, and I do get help from my friends, my colleague friends.
That's nice.
Yeah. We
Well, you
always
could
have
tell
to
if
ask,
you're already having something that maybe you had in the past and it's coming back, let's say a knee or
For
something.
example, I have 3 disc bulge, and I do CrossFit, I do my running, I do everything. It's not a life sentence.
Yeah.
Do you know what I mean? That's what I try to say to patients.
You've learned how to cope with that and to
Yeah.
live your life. Like,
Yeah.
there's no excuses.
Yeah, surgery is the last thing that need to be done. There's a lot of things that you can do in the middle. And there's a lot of people, you and me, we probably have 3 different types of disc bulge, and I am the only one with symptoms.
Oh, okay.
That's a natural process of the life. Because sometimes if you go to the surgery, you take one disc bulge, and you keep doing the same behavior, you're gonna have another one.
Oh yeah, it's like losing weight, like I forgot the bariatric.
Stomach sleeve.
Stomach
It's
sleeve.
the bariatric surgery.
It can stretch again, right? If you keep
Yeah.
eating like a
Of course.
pig,
If you
you're
keep
going
on
to
eating like
stretch.
Yeah, that can get worse because sometimes the scar can get glued to other parts of the body. Then you have another surgery to detach those things. There's always a risk after the surgery. So it's
If you don't change your habits, it's gonna happen again.
Yeah,
That's a tough surgery as well. Huh?
Yeah, we need to think about always before surgery.
You do
have a
post-surgery
train-
recovery as well for people that
Yeah, I
need...
do the post-operation rehabilitation a lot, especially for the knee.
Athletes?
Athletes, yeah.
Yeah.
Sometimes they go to surgery because we balance out rehabilitation and how quick they can go back to a sport. So surgery sometimes is the best way, but it's something that is no. It's not decided only on the symptoms. It's decided on your lifestyle, the need. It's a lot of things that need to be taken into account before you decide to go to surgery.
Interesting.
And also the surgeon
Not everyone is entitled to. Not entitled.
Even though
but
if you have all the symptoms there, you don't have a lifestyle. You smoke tons of cigarettes a day. Why I'm gonna work on your lungs with that?
I don't smoke tobacco.
Do you know what I mean? That's not the point. We need to individualize.
That's the brain stuff that Santiago was talking before. You need to have a mindset, and then of course you have to be connected with yourself in general. And people have been disconnected lately.
Oh yeah,
so that affects everything.
Yeah.
People try to blame everything else
but themselves. They don't want to look like. I remember my grandfather tell me once, when you point a finger at someone like that, there are 3 others pointing back at you. So pay attention to what you're doing, because you're actually trying to. It's about you that you're talking.
No, there's a lot of people
Look
coming to me
inside.
to say,
Thanks, Grandpa.
because my work, it's but what you do when you know work.
Yeah.
Where do
What are
you
gonna
sleep?
do?
Which position?
Instead of spending 15 minutes on the social media, let's say, why don't you just do 15 minutes mobility for your
I
hips or
say to
whatever?
patients, why you don't get off the bus one station before? Just do that.
That's
Because it
something.
rains
I
as
like
fuck
it.
in this country.
That's fine.
It's so
you're
windy.
getting home. You're gonna dry yourself. It's
You're
just
not gonna
one
die.
stop.
I prefer get home and exercise.
You're able to do that, but a lot of people they're not gonna do it. So
Yeah.
just drop off the bus one station before and get the walk down.
Yeah, true. You gotta know what works best for yourself, but then
it's
you're gonna
slowly but
try.
surely. I always
Go
do
testing.
something, yeah.
Interesting. I like this conversation overall.
Tell your friend to reach
I'll
out.
tell my friend. Yeah. I'm going as well.
Okay, good.
I'm going as well.
So it's a nice way for us to talk about health, you know. It's a health stuff though sometimes.
Yeah.
That's a very important
Drinking
thing.
water.
Talking about physical health, sometimes people talk much about working out, but they forget that those stuff, they actually put a load and
It's
all
one of the many things like you gotta be aware of, because it's not just like working out. You have also to work out properly.
Yeah, you need to know what you're
have to,
doing,
yeah.
and
You
otherwise
have
you're
to do
gonna.
things properly.
Yeah.
Yeah. I mean, like workout,
Meditate.
Meditation
stretch.
is amazing though. How the meditation can help. For example, when you go to the clinic, I always have a nice music on.
Yeah.
It's very chill place because that take off 50% of the pain.
Yeah.
And then we talk about the real pain when you're there. And people ask me, "Oh, you don't feel sleep with that music?" I said, "I am working. You are relaxing." I don't even remember the fucking song is there.
Yeah, you have to be. Your mind is actually somewhere else. You're actually working on something.
Yeah.
Oh yeah.
Whoever's there is.
But it does
have an
help.
opportunity.
That brings a kind of
calms.
Yeah.
Because sometimes people get like they're, oh my god, I'm
We
late,
always on
blah, blah,
rush.
blah.
We always
Yeah.
on rush.
Or is it
Always on
something
rush.
like sick of
Meditation
yourself?
helps a lot to bring that down.
I used to be in a rush like in the past a lot. Always anxious about what's gonna happen and this and that. Then I realized that I'm gonna die eventually. I don't know when. So why
What's
am
the
I
rush
rushing for what?
I know, it's very easy for me. I'm from Salvador, so I'm not lazy, but I'm chill.
People from Salvador, like I don't know, correct me if I'm wrong.
Yeah.
But they take their flip flops to queue instead of being there
Oh,
standing.
you know
why not?
Have you seen it? Yeah.
Why not?
I couldn't see this coming.
Be smart, right?
Yeah, why not?
No.
We have reinforced here the importance of moving. We have reinforced here the importance of not overestimate or underestimate your pain. And we have reinforced here to look to the right professional.
Always.
That's how strategic he is. His ways of thinking. So when you go there, he assesses.
Yeah, assess the patient.
The patient, and he goes, okay, phase 1, phase 2, phase 3. That's him.
Yeah.
It's structured. I like
That's
it.
him.
You have
It
a
is,
structure.
yeah, I always have a
methods.
structure. And I always listen to your story. Your story tells me more than the MRI. Sometimes patients tell me the story and I go right to the point and then they ask me, "Oh, you're right in the point." And then I say, when you go to the MRI, when I send you to get the MRI, it's going to be that tank in the MRI. Right? And there you go. What I'm looking is not that tank. What I'm going there MRI is the things that I didn't see on my eyes.
Am I right?
No,
Oh my
you
God,
needed
yeah.
to. I could see that.
Yeah.
Really? You thought of the same?
I was expecting it from you.
Yeah. You're right. Yeah.
But guys, the point is, I think that's the most important thing, because that's the reason why I wouldn't leave my GP, and that's the reason why I wouldn't leave you, because
Yeah.
I know the importance, that for me at least, of trusting that someone is gonna assess you and not a picture.
Yeah.
Well, the picture's there as supportive information, but you are having whatever it is. So that's the importance. Let's analyze that whole. As
Yeah.
you were saying, it is a whole.
It is.
So,
everybody's different.
yeah.
though.
Yeah. But you can fix them, right?
No, I
Yeah,
can't.
you can't.
I can't help you to get better.
They'll fix you. You've done too much already.
Yeah. No.
Thank you very much
thank
for
you
coming
guys for
today. It
having
was a
me.
Thank you so
pleasure.
much, yeah.
Thank you.
It's something that, like, talking about health and this and that, it used to be boring for me in the past.
Yeah.
But we're in Ireland. It's funny because, I mean, we hear stories about, just give some paracetamol.
Oh, gosh,
Yeah.
I like it. I kind of like this kind of
no,
stuff.
that's a
talking
really
about
good
health.
thing. Also, sometimes people think the medication is everything, but take anti-inflammatory in the sprained ankle at the beginning is going to delay the process of the ankle recover. Mm-hmm. You know what I mean? There is a certain period of time that you should get the medication, but not always. Because the medication can delay the healing.
Like the injection. Injection is supposed to do something. If you're doing something else, it's not going to work.
Yeah. So the injection, So sometimes, get less medication. Get more knowledge.
Yeah. And more active.
Yeah.
Yeah. Go work out. Stop complaining about your weight.
Yeah.
No, there is a lot of things behind the weight. But I stop complaining about
anything in start of action.
Just do something, no matter what you have. So I'm skinny. I do things, that doesn't limit myself for being like carrying heavy weight because in the past I used to be intimidated by my size.
Because you have muscles, man. Rasgado. Ripped. You're ripped. So you have a lot. You're pure muscle. So that's fine. Your leg is tiny, but it's pure muscle. So you probably have more muscle than I do. So I've never seen him naked. Okay. Let's keep it like that.
Yeah. Search for a professional.
Well, there is a lot of professionals.
Are you offering your services? Yeah.
So offer your services for us, please.
Our service. It's Igor Castro Pain Relief. It's right on O'Connell Street, so it's very easy access to everybody. And the book page is online. If you have any questions, you can text me on WhatsApp.
That's what I wanted to hear.
Yeah, and he's great at responding. Yeah. Because I've been bothering for all this shit. Oh my God, I'm gonna die.
Sometimes take time for me to respond, but
I don't respond. It takes time, but he responds.
He's very responsive. I'm not. Not at all.
No, in the job,
Good stuff.
Yeah.
Thank you very much again.
Thank you, guys. Thank you.
And agora como é que encerra, brother? Encerrar é uma merda.
And if you like this content, and I don't know,
follow for more.
We have so much more for you.
That's it, guys. Thank you very much. We're gonna keep having amazing people. Thanks again.
Thanks.
See you soon.
That was very nice. Thanks.
Oh yeah.
See you soon.
See you soon. Yeah.
See you there.
Where I don't know, but see you there.
Acabou.
Vocês querem acabar? Acabou.
Ai, supositório.
Supposed to be.
Supositório. Posso fazer um top-up rapidinho?
Faz seu top-up. Também quero top-up. Quer um top-up?
Não, tô bem, gente.
Pega. Top-up. Você quer um top-up branco?
Branquinho. Ah, vou querer um branquinho.
Tome branquinho. Você tomou tudo aí? Faz um top-up. Um top Elvis aqui, ó.
Obrigado, tia Dirce. Tia Dirce é maravilhosa.
Aqui, ó. Pediu pra parar, parou.